A very good morning to doctor and students. We are from Lab 9 and we would like to present our research on depression among medical students. Without further ado, let's move on to chapter 1. What is actually depression? Depression is a common mental disorder characterized by persistent sadness and a loss of interest in activities that you normally enjoy, accompanied by an inability to carry out daily activities for at least 2 weeks, according to WHO. People with depression normally experience several symptoms like feeling a loss of energy, a change in appetite, sleeping more or less, restlessness, anxiety, reduced concentration, indecisiveness, feelings of worthlessness, hopelessness, and guilt, thoughts of self-harm or suicide. Depression is actually treatable with talking therapies or antidepressant medication or a combination of this. Depression is different from sadness or grief. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. For example, in grief, painful feelings come in waves, often intermixed with positive memories of the deceased, while in major depression, mood or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained, but in depression, feelings of worthlessness and self-loathing are common. To justify our research, on 10 of November 2013, one of UKM student Ivan Wu, aged 21, committed suicide due to depression in his home as he wanted to change course but his parents did not agree. The aim of this study is to screen for depression among medical students, thus preventing this incident from happening again. Therefore, there is a need to determine the prevalence of depression and its risk factor in order to observe any changes from previous years and to make a strategic plan to help the student cope with stress. This study aimed to measure the prevalence of depression among preclinical medical students and to determine its associated factors. The selection of preclinical students is determined to identify the problem at an early stage in order to help the students to cope with their depression. We have concluded some hypotheses. First of all, female medical students are more prone to depression compared to male. First-year medical students are more likely to have depression compared to second-year medical students. Medical students that are overweight are more prone to depression compared to medical students that maintain normal BMI. Medical students that do not have scholarships are more likely to be depressed. Fear of failure and the increase of academic workload will lead to an increased probability to have depression. The older the medical student, the higher the risk of depression. Malay medical students are more depressed compared to other races. Medical students coming from low-income background are more depressed. Medical students that consume alcohol are more probable towards depression. And last of all, medical students that are smoking are more depressed. Let's move on to literature review. For gender, according to a study done by Sharina M.S. and Nandarajan Kinson in 2003 on prevalence of depression among UPM medical students. Female students show a higher percentage of depression compared to male students, with 41.4% while males only 27%. As for age, depression among older adults in United States are estimated around 10 to 15%, and this number increases in the institutionalized elderly. United Kingdom, Asia Pacific, Indonesia, Vietnam, and Japan have resulted in depression in about 17 to 33%. As for race, it is found on the study, prevalence of depression among Malay was the highest compared to other races. Based on studies carried out by Joseph M. Bowden, there is a connection between smoking and depression, where there is an increased risk of symptoms of depression to those who smoke cigarettes. The study, which assessed alcohol consumption among medical students with the prevalence of depression, shows that high level of depression does not have relation to alcohol consumption. As for overweight and obesity, a study was carried out among medical students in Egypt, which shows that the proportion of overweight and obese students was 23.5% and 15.5% respectively. The result shows that among 168 overweight and obese students, only 52 of them are not depressed. 60 students are mild-moderate depressed, while 56 students are severely depressed. As for low income, studies have showed that the undergraduates had higher prevalence in getting depression and anxiety disorder compared to graduate students. Students who have financial struggles were reported to be in higher risk group of getting mental health problems. These findings highlight the need to address mental health in young adult populations, particularly among those of lower socioeconomic status. As for examination performances, according to a study, increased academic workload and fear of failure are the factors leading to emotional disorder among medical students. Based on the study, emotional disorder has higher prevalence on students who experience severe and extreme pressure due to examination compared to students experience little pressure or none at all because of examination. Frequent academic examination in a competitive environment is one of the stressors leading to depression. For educational fee, increased tuition fee in recent years led to the increase in student debt. This is also one of the most common causes of student stress.
So for the research procedures, the first thing we did was we collect the data using DAS21, and then we analyze it using Statistical Package for Social Science SPSS version 16, and lastly we prepare the research report and presentation. For the research design, this cross-sectional study has been conducted over preclinical medical students at National University of Malaysia UKM from 6th of November until 12th of November 2017. UKM is a Malaysian public university that was established in 1970 that has 3 campuses, and the campus that includes the Faculty of Medicine is located in Cheras Selangor. Preclinical medical students were asked to participate in the study. The purpose of the study was first explained, emphasizing that the collected data will be strictly confidential, and their verbal consent was also taken. An online Google form was prepared for the volunteered students to be part of the research study. Inclusion criteria. Medical students of UKM who are in Year 1 and 2 were chosen for the research study. Exclusion criteria, non-citizen. Sample size. A sample size of 100 respondents were required in the study. Instrumentation. 2 self-administered questionnaires have been used as data collection instruments and distributed to selected students. The first questionnaire is a structured self-generated questionnaire for identifying demographic characters and risk factors of psychological illness among this population of students that could be related to social, demographic, behavioral, and/or academic causes. And the second questionnaire is a short version of the Standardized Depression Anxiety Stress Scale, DAS, which is a 21-item questionnaire. It is a set of 3 self-report skills designed to identify the presence and measure severity of the negative emotional states of depression, anxiety, and stress, 7 items per scale. Data collection, a convenient sampling method was chosen by distributing a Google form link prepared earlier through WhatsApp to achieve as much respondents as possible. There are no time limits set to answer all the questions. Discussions are not allowed while answering the questionnaire to avoid any disturbance that could affect the validity of the results. Operational definition of variables. So we use 2 kinds of variables, dependent and independent variables. So under dependent variable, there is only depression. It is according to DAS21 scoring, yes and no. Under independent variables, the first one is age. For the definition, for example, it is taken from Malaysian identification card. Second one is gender, male and female. The third one is last examination achievement, which are categorized into 2 groups, pass and fail. The next one is monthly parent income, which are grouped into 3. The first one is less than RM 3,900. The second one is between RM 3,900 to RM 8,300. And the last one is greater than RM 8,300. Next, ethnicity. It's either Malay, Chinese, Indian, or others. For the year, it's for Year 1 and Year 2. BMI, it's either underweight, normal, overweight, and obese. For the scholarship, smoking and alcohol intake, it is either yes and no. For the statistical analysis, the data was analyzed using Statistical Package for Social Science, SPSS version 16. SPSS is a Windows-based program that can be used to perform data entry and analysis and to create tables and graphs. SPSS is capable of handling large amount of data and can perform all of the analysis covered in the text and much more. Biological determinants, social determinants, and behavioral determinants all can lead to mental health problems such as depression, anxiety, and stress. Respondent characteristics. Total respondents are 100. Characteristics of the respondents. So first one, we look at the variable, and then we'll be looking at the frequency and percent. The frequency and percent will be the same as our respondents are 100. So for the first one is gender. For male, it is 26. Female, 74. For age, 19 is 31. 20 is 59, 21 is 9, and 22 is 1. For the ethnic, for the Malay is 66, Chinese is 17, Indian is 14, and others is 3. And the year 1 is 35, while year 2 is 65. BMI, for the underweight is 19, normal is 63, overweight is 7, and obese is 11. Scholarship, yes. For the scholarship receiver, yes is 61, no is 39. Achievement, pass is 84, fail is 16. Smoking, yes is 0, no is 100. Alcohol, yes is 4, no is 96. Family income, that is less than Rm 3,900 is 41. Between Rm 3,900 to Rm 8,300 is 33. And greater than Rm 8,300 is 26.
Okay guys, now we move on to bivariate analysis. This is to analyze whether there is an association between factors and depression. The first factor is gender. The result shows that 3% male and 8% female were depressed. However, the p-value is more than 0.0.5. Therefore, there is no significant difference in depression between female and male. Okay, the next factor is age. 9% of 19-year-old students were depressed. The p-value is less than 0.0.5. Therefore, there is a significant difference in depression between age. The third factor is ethnicity. Malay recorded the highest depression with 9%. The p-value is more than 0.0.5. Therefore, there is no significant difference between ethnicity. Okay, next factor is year of study. So the first year recorded 8% of depression and the p-value is 0.0.8, which is less than 0.0.5. Therefore, there is a significant difference between year 1 and year 2 in depression. Okay, now we move on to the next factor, which is BMI. The result shows that normal BMI recorded the highest depression with 8%. The p-value is more than 0.05. Therefore, there is no significant difference between BMI in depression. Okay, as we can see here, 9% of our respondents without scholarship are depressed. The p-value for this factor is less than 0.05. Therefore, there is a significant difference between scholarship in depression. Okay, next we move on to the next factor, which is academic achievement. 11% of those who pass the examination shows that they are depressed. The p-value is larger than 0.05. Therefore, there is no significance between those who pass and fail the recent examination in depression. Next factor is alcohol. Those who did not drink alcohol recorded 11% depression. The p-value is more than 0.05. Therefore, there is no significant difference between alcohol consumer in depression. Last but not least, the last factor is family income. The p-value is more than 0.05. Therefore, there is no significant difference between family income in depression.
For the discussion, in present study, it shows that age, year of study, and educational scholarship are associated with depression among UKM medical students. One of the significant results is gender. Our study shows that gender is not one of the risk factors of depression. This is due to other factors that comes together with these factors such as age and underlying disease. Besides, we found that ethnicity is not associated with depression. Meanwhile, a study stated that Malay ethnic has the highest prevalence of depression. This is due to we have more Malay respondents than other races. Limitation. Our focus respondents are from UKM medical students only. Most of the independent variables were self-reported. Time limitation due to hectic schedule. The questionnaire were given randomly. In conclusion, the prevalence of depression among medical students is 11 over 100. Depression was significantly higher among respondents who are in Year 1 medical student and the one who do not have educational scholarship. Further study is needed to explore these factors as well as to do intervention study on anxiety in this population to allow early detection and appropriate intervention in future.